Okay, good morning, and thank you so much for joining us today as we take the next step in an effort that's intended to expand our system's capability to learn and ultimately to grow and improve. For those I haven't met before, I'm hoping that's not many on the call. My name is Christine Norbert-Beyer, and I have the privilege of serving as the Commissioner for the New Jersey Department of Children and Families. And today we're discussing kickoff of the third phase of our Office of Monitoring work within the department. The Office of Monitoring is relatively new to DCF, having been created in 2021. The goal of this unit is to connect with our contracted service providers and to get a clear picture of the service array delivered to New Jersey's children and families in support of our system's ability to learn and adapt. There may be something we figured out that we do really, really well in South Jersey, but they might be struggling with in North Jersey or vice versa. And yet too often we get caught up in the work and the best ideas are stuck in silos. We want to develop our ability to work as a system, not just as individual providers fulfilling the terms of a contract. In 2022, we began with the initial phase of providers that were brought online within the Office of Monitoring, and so far, we've been able to collect good data and learn so much about the services being delivered to children, youth, and families throughout New Jersey. When I think about the role of the Office of Monitoring within the larger scope of DCF's work, I put it in context within our DCF strategic plan. When we originally advanced our strategic plan in 2019, we developed certain overarching core approaches to the work of our department, and by extension, to the contracted partners engaged with the department. We're striving to be a collaborative system with partnerships and information sharing from traditional and non-traditional partners. From the department standpoint, we're used to working pretty collaboratively with social services focused departments like the Department of Human Services and the Department of Health. But collaboration isn't and shouldn't always be just about those easy partnerships. How we are engaging agencies that are tangentially connected to our work, like the Motor Vehicle Commission or the Department of Military and Veterans Affairs, right? How do we do that? So through the Office of Monitoring, we're hoping to get information about the partnerships that you're forging to do your work so that we can assist other agencies that may be struggling with a problem that you've already solved. One of our core approaches speaks to the advancement of evidence-based strategies to support children and families in New Jersey. Through the Office of Monitoring, we'd likely want to know what evidence-based models you're using in your work. As the federal government transitions funding streams to be more prevention focused, and New Jersey is in the process of finalizing its Family First Act 5-year prevention services plan with the feds, we have if we have an accounting, right, of evidence supported and evidence-based programs operating in New Jersey, that could be useful to allow us to leverage additional federal investment into our system. So learning, like there are things we will put in place and then learning maybe what many of you already have and how can we incorporate that into our like fully fleshed out system. Ultimately, at the end of the day, I think that the Office of Monitoring speaks most to the connected part of our vision for New Jersey, that all residents be safe, healthy, and connected. Connections aren't just between the people we serve. We want our programs engaging with each other, sharing vital information that allows us to advance and promote the best initiatives, the best strategies, and the best that our system can deliver. I want you to look to the Office of Monitoring as a partner in this work. They're here to forge a systems approach to our work and ultimately to ensure the highest quality services for the people we serve. So with that, I'd like to just go over today's agenda. During today's brief meeting, we will look at the purpose of the department's monitoring approach. We'll look at the work of developing the Office of Monitoring's portfolio and focus. In particular, we want to define the office's role within the department and its collaboration across divisions within DCF, as well as a discussion of the development of quality standards for service contracts. We'll talk about the evolution of our Office of Monitoring strategies over the last year. We'll discuss the launching of the Wave 3 work groups and data subcommittee, as well as our approach to live monitoring the latest cohort of programs. And finally, we'll open it up to Q&A with the audience and the next steps for the start of this work. Most of what we cover today is information that can be found in a written concept paper, which is available on the DCF website. To start, let's briefly revisit why DCF has decided to launch this new monitoring practice. In the summer of 2021, DCF released a concept paper that outlined the department's vision of a new proactive monitoring approach for our work. The annual DCF budget is about $2 billion, and about half of that is funding for social service programs that operate under contract to the department and that are provided directly to the residents of New Jersey by your programs and agencies. I think all too often when the public considers the work of DCF, they limit that vision just to the protective child protection services work being performed by DCP&P. In reality, DCF is far more expansive. Through the Children's System of Care, we're working with children and youth who may be experiencing behavioral or emotional challenges, or may be living and thriving with intellectual and developmental disabilities. Our Division of Family and Community Partnerships is focused on supports and services designed to prevent child maltreatment and address the social determinants of health that can lead to child maltreatment. Through our Division on Women, we're focusing on empowering women and girls and helping survivors of domestic and sexual violence to heal and move forward for themselves as well as for their families. For the department, monitoring and measuring the performance of the public service networks we manage is one of the many ways we advance our transformation and ensure high-quality service. This effort allows the department to ensure fidelity to practice models and consistent outcomes through informed decision-making and effective resource management. It's about how we manage resources effectively. The Office of Monitoring serves as a full infrastructure to assess the performance of the contracted public services that we fund and oversee, and to measure more comprehensively the elements of customer service that are most important to constituents. In the context of our strategic plan, while the Office of Monitoring embodies many of the different aspects of our work reflected in this graphic, I think most prominent in its charge is the organizational value of evidence. We're looking to the Office of Monitoring to provide that evidence that our programs, practices, and approaches are working for the people of New Jersey. To be clear, there are some things we're doing right now as a system that may end up changing as a result of what we learn. We need data to inform our decision-making about the services and supports we procure on behalf of the people of New Jersey. Ultimately, it's about evolving our system. Maya Angelou said, "Now that I know better, I do better." We want to do better for the children, youth, and families that we support through the Department of Children and Families. So thank you for being here. And with that, I'll turn it over to my colleague, DCF First Deputy Commissioner, Katie Storr, to share more information about efforts related to monitoring. Katie?
Thank you, Commissioner. So as Commissioner Beyer mentioned, almost half of DCF's public service network is privatized. While these services are provided by private entities, they are public services intended to provide support and intervention to New Jerseyans at some of the most difficult and troubling times in their life. These services are life-altering. They're life-altering when they're high quality, but they're also life-altering when they're of poor quality. As the state agency overseeing these service networks, it's our job to work to make sure constituents have access to the help they need, that they receive help in the form and manner that best fits their particular circumstances and needs, and that what they receive is of the very highest quality. To meet our obligations to manage these large service networks, DCF has used a variety of monitoring methods in the last 18 years since its creation in 2006. You can see that right when we were starting the Office of Monitoring, and historically, we've been doing things like counting how much service has been provided, or levels of service, how many families or individuals are enrolled in a particular service. And then, not in a systemic way, but for some programs, we were examining the compliance of documentation or other processes. We were maybe doing site visits, and for some programs, we're collecting data for research or outcome evaluation purposes. The problem with this, if you look at it across a whole state, is that there's an inconsistent depth of monitoring and an inconsistent frequency of monitoring. There's an inconsistent depth of standards and expectations that are implied in that process. There are inconsistent feedback loops to you as providers and internally to program leads or department leadership about what's working or not working. And there's a lack of valid and standardized tools in use across the department. So these were the problems we were trying to solve. The commissioner shared in her opening remarks that we have a good bit of information from the listening tour about what it's like for constituents to receive services from DCF, whether those services are delivered directly by our staff or delivered by providers operating on our behalf. We have additional information from previous years of needs assessments, the Federal Child and Family Services Review, and multiple other sources as well, like our Youth Council, Parent Council, Fatherhood group. In the spring of 2019, we shared this information with providers and other stakeholders during our regional forums, which many of you attended. We collected feedback from stakeholders, including you, at those forums and in other venues about important dynamics that are contributing to the challenges identified throughout 2019 and 2020. In the fall 2019 regional forums, we shared our intent to develop stronger monitoring practices for the department. The COVID-19 pandemic temporarily disrupted the development of DCF's work in this area as efforts to manage the emergency at hand took precedent. But by the summer of 2021, we were ready to move forward. In July 2021, we issued the concept paper that the commissioner referred to earlier regarding new monitoring practices for public feedback, and we held a webinar announcing the new Office of Monitoring. And we then got to work. In March 2022, we announced and began developing new monitoring approaches for our family preservation services, direct domestic violence services, and keeping families together programs. Then in July 2023, we started working with care management organizations, intensive residential treatment services, psychiatric community homes, regional diagnostic and treatment centers, and the Child Protection Substance Abuse Initiative on developing and implementing monitoring for those programs. As of today, we have completed monitoring for family preservation services, domestic violence direct services, and keeping families together. And we're in the midst of monitoring intensive residential treatment services and psychiatric community homes, and about to launch monitoring for care management organizations, the Child Protection Substance Abuse Initiative, and regional diagnostic and treatment centers. DCF's work to restructure our monitoring of the contracted service network is intended to ensure that the department has a full infrastructure dedicated to assessing the performance of the public service networks that we fund and oversee, and the ability to more comprehensively measure aspects of service that are the most important to constituents themselves. At this point, I'd like to turn it over to some of my colleagues to just weigh in on what it's been like to engage with this process and how things are working. Sandy, can we start with you? Would you like to talk about your thoughts around the shared vision between family and community partnerships and the Office of Monitoring?
Thank you, Katie, and good morning, everyone. On behalf of the Division of Family and Community Partnerships, we have appreciated participating in the establishment of a well-thought-out department-wide strategy for program monitoring. We all value the importance of providing high-quality service delivery to families that are engaged in our programs. The implementation of a standardized monitoring approach will provide meaningful data that will promote consistent program management and program accountability, and it will provide a shared platform for division program staff and contract agencies to have meaningful discussions about programs and the strategies developed to continue to enhance service delivery. And thank you to the Office of Monitoring. We will have that additional support for the important work that we are collectively undertaking on behalf of children and families.
Thanks, Sandy. Anna Martinez, who manages the Division on Women, was unable to join us this morning, but I know that she shares your sentiment, Sandy, and your thoughts about this office. I'd like to now hand it over to the Director of DCF's Office of Monitoring, Chastity Garcia. Chastity joined DCF in 2021 with over 25 years of experience in child welfare and over 17 years of experience in building and overseeing service monitoring in New York City. Chastity?
Thank you, Katie. And I'm happy to meet everyone again. So our goal is to share information gathered through monitoring to identify areas for improvement or change in the service network. We are doing so by monitoring provider performance against uniform quality standards across DCF contractor services, incorporating clear program models and program performance standards into monitoring, creating sound, participatory, and transparent methods and tools, maintaining consistent feedback loops, using information gathered through monitoring activities to support program leads and collaborative quality improvement processes, and effectively deploying departmental resources. So our monitoring practices are standardized, transparent, incorporating parties identified by service recipients, using reliable data, and sound evaluation methods occurring regularly. This restructuring has changed the type, frequency, and manner by which providers are monitored, and monitoring practices are built over several years. Our monitoring practices include assessment of quality, referral and constituent experience, adherence to service models, and examination of outcomes and services. In order to maintain service excellence, ensure provider compliance with their practice standards, and gain a variety of perspectives, the Office of Monitoring's methodology includes conducting interviews with clients, administering referent surveys, reviews of case records, and site visits to provider agencies. The roles and responsibilities of the divisions who most closely collaborate with Office of Monitoring were clarified to facilitate DCF's internal launch of DCF's monitoring. This role clarity crosswalk illustrates the roles of each division and clarifies the scope of the Office of Monitoring. The Office of Monitoring carries out program monitoring activities and functions independently of, but in partnership with, program offices, and is responsible for developing and implementing monitoring protocols, methodologies, and overseeing the day-to-day work of the monitors. The program offices maintain their current functions, such as managing the network of services, network community of practice, oversight of day-to-day management issues, managing the quality of the network, including the imposition of corrective actions, and working to enhance or change program models, and managing partnerships with other public services. The Office of Analytics and Systems Improvement continues to advise on the development of monitoring tools, conduct research and evaluation activities on priority programs, develop reporting methodologies, scorecards, and dashboards, and to facilitate communication and interpretation of findings through data briefs and data walks. The Office of Licensing and Office of Youth Residential Licensing continues to license and regulate youth residential programs and children's partial care programs, as well as monitor licensed programs' overall compliance with the applicable regulations and standards, including site inspections. And the Office of Contract Administration continues to work in collaboration with DCF program offices and the Office of Monitoring to administer third-party social service contracts between DCF and providers. The office will also continue to monitor providers' compliance with state and federal administrative requirements and compliance with contractual requirements. So, as you know, DCF's strategic plan names its values collaboration, equity, evidence, family, and integrity. The quality standards are one way in which we are able to share with the constituents we serve, with providers and other key stakeholders, how these values are expected to be upheld within our network of purchase services. So the quality standards do not replace any of the existing set of principles that are endorsed within any DCF division or portfolio of service. We modeled the quality standards after the United Nations Availability, Accessibility, Acceptability, and Quality Framework, also known as the AAAQ or AAAQ framework, which lays out a set of essential elements that can be taken up by governments to inform the setting of standards and targets for service delivery, particularly in the health and human services spaces. It's been used previously in the fields of reproductive health, water rights, gender-based violence, maternal mortality, and others. The quality standards exist in addition to any contractual or service standards that are already in place for a given program, as you see here. In fact, many of DCF's contracts already include language that addresses the substance of various quality standards. Over time, we will be working to ensure that all of DCF's contracts have embedded the quality standards into the contract expectations. In order to obtain more detailed information about DCF quality standards, please visit the Office of Monitoring's webpage, where you will find a recording of the webinar we held with providers regarding these standards in August of 2022. Monitoring practices and tools are being developed and implemented in waves, and to achieve this, we apply some considerations such as program readiness, whether a program has been identified for Family First Act collaborative quality improvement planning, and contract detail to identify which service lines are to be monitored during each wave. Additionally, the level of monitoring will vary depending upon these considerations. At a minimum, we will monitor the provider's performance against the DCF quality standards for providers mentioned earlier, and/or monitor the adherence to the contract's documents. This slide summarizes the monitoring waves since DCF launched its new monitoring approaches during the summer of 2021. Thus far, we have launched 3 waves. The programs with asterisks have either undergone live monitoring or are currently being monitored. Each of your programs have been identified for the 3rd wave of monitoring. So what does this mean for you? Next month, DCF will launch a 5 to 6 month tool development process and will work with providers, constituents, and DCF program offices to develop monitoring methods, tools, and to identify data elements and data collection methods. We'll be looking to you as providers to weigh in on the monitoring tools as they are developed, especially in evaluating their relevance, clarity, and suggesting edits. The DCF program offices will identify working group participants from the provider network, so you should hear from Sandy and Anna's shop soon if you haven't already. And although the tool development process for your programs will take 5 to 6 months, you will only need to attend 2 90-minute working groups for a total of 2 months. To be clearer, 4 meetings. Okay, so that's all I have. We would like to now transition to our Q&A session. Jason, are there any questions?
So we just have one question so far. Someone said that the webinar is being recorded and they were wondering if they would get a copy. I know we were planning on sending out the slide deck. Will we also be sending out the video of today's webinar?
Yes. Is it being recorded, Jason?
Yes.
Yes. Then we will share it. Any other questions?
For SV programs, the person was asking, do they fall within the 3rd wave? And they were just a bit confused about that.
This is for sexual violence. If it's for sexual violence, yes.
Yep. An anonymous attendee asked, are there any metrics that templates that they can have, I assume, to be able to satisfy the monitoring requirements?
So we have on our website and on our webpage, we have the DCF quality standards with the details by domain and by each standards, the areas that we're going to be looking into. And I think that that would be helpful. And in regards to practice standards, we'll be looking into your contracts or any program models that you might have in order to identify the areas that we would be monitoring. Kitty, is there any additional information you might have?
Sure. Yeah, I think that that's right. And the process of coming up with the actual questions for the tools is going to be informed by input from the constituents who use the services and from the providers themselves, in addition to the contracts and the quality standards. So those tools have not yet been developed. You'll all be part of that. You'll understand how that's going to play out.
That's correct. Thanks, Katie.
This next question, I think, is for Sandy. The person says that they see that the family-friendly centers are included on the list. Does this also include the family success centers too? I believe the family-friendly centers are under school-based, right, Sandy?
Yes, the family-friendly centers are part of our school-linked programming, so two different sets of programs. And Chastity, I believe that we have both of those programs in this next wave.
Yes, we have the family-friendly centers as well as the family success centers.
Someone's asking the question, so there will be this second level of monitoring in addition to our regular monitoring.
So so yes, we're monitoring, but I'm not sure what you mean by a second level of monitoring unless you are being monitored by, for example, the Board of Education or anything like that.
And I would just
Yeah.
encourage, that's an anonymous question. It's hard to know what angle that's coming from, but if that person can reach out to either the Division of Family and Community Partnerships or the Division on Women, to your program lead, to ask that question, that's probably the best next step for you.
Someone asked, what is the first step that agency should take in preparation for being folded into the monitoring program?
Yep. So we will be reaching out to you if we haven't already done so to invite you to the working groups. And each working group will be tailored towards the tool development process, as well as identifying the monitoring approaches, so on and so forth. So there's not much you need to do other than to definitely bring your expertise to the table so that we can work together on developing the monitoring approaches.
We got this question, would there be an implementation of a platform for data collection? So I'm thinking that's probably software based.
So we currently have a data collection system that is in place, but we are also working on developing a web-based application for data collection. And we do have a scorecard dashboard that will be shared with all providers so that they can see the results of their monitoring.
But to be clear, Chastity, the providers are not really the ones doing that data entry, right? It's your monitoring staff who are going to go out and read the records and, you know, if it's a residential program, do a site visit, et cetera. Providers need to make your records available, but you aren't the ones doing the data entry. It's Chastity staff.
That's correct. And sorry for the misunderstanding.
So the next question we got was, is there any way that the website could be shared here to make sure we are getting the one that's required? And I believe that's probably in the PowerPoint that we're going to be sending around the Office of Monitoring website. Will there be site visits for monitoring? So actual physical site visits to programs.
So the quick answer is yes, but it all depends on your service line. Site visits is one of our monitoring approaches, but we decide that together once we figure out if site visits are appropriate for your program around gathering information.
Is there any specific information for legal providers on monitoring regarding the client interviews and records reviews and client attorney confidentiality?
So we do have a letter that we will share with providers around the sharing of case records based on your contractual agreements. In addition, when we conduct any parent interviews, we do ensure that we obtain consent from them. And in regards to the live monitoring, we don't seek consent to read records because it is part of the monitoring process that is agreed upon when it comes to the contracts.
Okay, the next question is connected to the Family Success Centers. With there being 59 Family Success Centers, how will you measure the metrics of all centers, seeing how they serve different areas and serve different communities and have different programs? So I guess,
So-
Sandy, that might be on you.
Well, it may be, but I'm going to ask Chastity to assist.
Okay.
I think in my comments, I had indicated that that this approach will provide a real good platform for us to have a meaningful discussion, because you're absolutely right. It's a single set of programs, but it's not one size fits all. But there are commonalities across each of the Family Success Centers that we are able to measure. But again, I think that what's important is that we have great data that'll come out of this, numerical. But that numerical data also has to have some discussion and context behind it. Shasta, I don't know if there's anything that you'd like to add.
That is correct.
Thanks for the backup. This next question is again around the FSCs, but I think it's probably applicable to all programs. It says, given that the FSCs have not seen any increased funding, will there be additional funds provided to ensure all programs have the capacity to be compliant with monitoring?
So let me take that one. There are no additional requirements being imposed through these monitoring tools. The monitoring process is going to be assessing the extent to which any program, Family Success Center or others, is adhering to the contract that you already have. So it doesn't require additional funding to be working in that way. That's the contract that we already have with you. There are no new additional requirements.
Thanks, Katie. How will sites be selected for the working groups? Will we know if we are not selected for the working groups, just so that we are not still waiting to hear word about participation if not chosen?
So what we have typically done is we make outreach to the providers that have been identified. We do not historically send out emails to everyone else letting them know that they have not been selected.
Is there a time frame by which the selection would happen so that people know if they haven't heard back by this time, they haven't been selected?
So some of you already know, and I believe that for most programs, those providers already know. So I guess a better way to say it is that if we have not made any outreach to you by today, with the exception of the Family Success Centers, it's more than likely that you have not been selected.
This next question is, who do you recommend attend the 90-minute meetings to develop tools and approaches? Is this best focused on program directors, frontline staff? What's the recommendation?
So typically the recommendation is for an individual, first and foremost, that has decision-making power. Because there's going to be, for example, questions that we will ask or case records that will have to be shared, so on and so forth. And we need that individual to be able to make the decision during the working group session. In regards to the level of staff, we don't have any positions other than anyone that is extremely well-versed in the program so that they can assist us with developing a very comprehensive tool.
Okay, I think this question has already been answered, but I'm gonna follow up anyway. Will the will the FCS have a centralized data collection software to capture data? I don't know if that's FSCs or FCS.
So yes, again, we will be the ones collecting all of the data. The providers, again, like Katie mentioned, will only need to either provide us with access to the site or provide access to the records, or if there are any interviews with youth, depending on the service line, access to such. Any other questions, Jason?
Yeah, I think there's a lot of it seems like some of these questions have been answered already. There's one last one that I can see here. It says, for many of us, the notices get sent to someone higher up, so we don't know that we got notice. Therefore, is there a way that we can contact you or someone to ask specifically about our area instead of waiting for a notice that someone in our company may not realize they have or may not realize we specifically need to know about? Thank you. So I guess this is like if a notice gets sent to a CEO and they weren't aware that it was coming, or if there was, something got caught in somebody's junk folder or anything like that.
Yes, you can always reach out to me at dcf.monitoring@dcf.nj.gov. And we will also share the slide deck where we will have at the end that link.
I just want to underscore, please feel free to reach out to Chastity. She's very responsive. That issue used to happen to me all the time when I worked on the nonprofit side. I completely understand that. So please, any questions, please just go ahead and reach out to the Office of Monitoring or to DOW or FCP, depending on which division your program falls under. We definitely want to be able to communicate with you and make sure you have all the right information. So please do reach out.
Yeah. And in the chat, I put the link to the Office of Monitoring website on the DCF public facing website, as well as the email address that Chastity just shared. It'll also be in the PowerPoint that we share when that goes out. One more question. What factors were considered or determined? What factors were considered to determine if a site was selected to participate in monitoring?
To participate in monitoring or to participate in the working group? If it's to participate in monitoring, all sites are going to be monitored. If it's to participate in the working groups, again, we considered we worked with the program offices, and the program offices identified the individuals that have decision-making power and also are well-versed in their programs to be able to contribute to the tool development process. And let me just say this. We would love to have everybody present. However, working groups typically function much better if we have 8 to 12 people participating, and because there's also internal stakeholders, to have everybody involved in the process will kind of make it a little bit difficult. But we are also thinking about and strongly considering, and I have already talked to Katie about this, is that once the tools are developed, we do want to share them with all of the providers publicly so that you can all provide comments and input and feedback into the tool.
Great. So at this point, I do not see any additional questions in the Q&A.
Okay. So what I would like to do now is share the next steps. So we are kicking off the monitoring working groups for displaced homemakers and Hispanic women resource centers next month. We'll do the same for the hotlines this December, the family success centers in April of 2025. That's why we have not identified the working group participants as of yet, and both sexual violence direct services and culturally specific sexual violence services in May of 25. That also includes these two programs. We haven't identified working group participants as of yet. This slide also lists some other activities such as entrance conferences and live monitoring. do not worry about writing these times down, as everyone will receive a copy of the slide deck. Okay, so
Chastity, I don't think you were showing your slide deck.
I'm sorry.
I don't think you were showing your slide deck as you were talking about that. You might want to put the slides up.
I see the slides.
I
Do you
don't see them.
I see them as well. I guess if anybody of the participants are not seeing slides, can you let us know in the Q&A? But you'll all receive these over email as well, right, Chastity?
Yes.
Okay, it looks like they're seeing the slides, so maybe maybe you're zoomed, Andrea. Sorry.
Okay, so thank you for your time and for supporting our improved monitoring approaches. Again, if you have any additional questions, please feel free to send them to dcf.monitoring@dcf.nj.gov. And I also entered my direct email address in the chat, so you can also feel free to reach out to me directly. Thank you, and have a great Halloween.